Young people have boosted the vaccination drive. More than 500,000 young adults registered after 18 to 34-year-olds were made eligible just yesterday, and more than 76,000 in that group were vaccinated yesterday. In total, more than 500,000 young adults have been vaccinated, but that of course includes young healthcare workers, students, civil servants and others who got the jab earlier. Is this all good news in light of research, however, that suggests young adults are among the most vaccine hesitant in South Africa? Or is communication to those sitting on the fence or those potentially not wanting the jab still a very big issue? We're joined by Tessa Dooms, who is a member of the Secretariats of COVID Comms, a non-profit volunteer group producing public health educational material. Thank you for being with us, Ms. Dooms. There was a lot of enthusiasm among young adults yesterday. Is that great, or do you think the converted will always register early and there's still that very concerning underlying vaccine hesitancy?
Thanks, Francis. Yes, so we've seen that at all the different age phases that have been eligible at different times, that you do have that initial surge in numbers. But we've seen with all of the age cohorts that after a few weeks, that kind of tapers off without us getting the sufficient numbers that we would want in each of those age groups. And we, as much as we are excited to see as many young people turn up as had yesterday, what we want to see is a sustained increase in registrations, people actually turning up for that jab, and the building of confidence. This is a large age group. It's a group that really consists of many adults fall into this part of our population. And so they are really going to be key and central to getting us over the line. But the hesitancy is definitely still an issue for everybody, including the younger age group.
Well, we'll talk about the quality of messaging from government. Sometimes has there been mixed messages? And has government missed the boat to some extent to really talk about vaccines? Because we know that there's a window when people can be convinced about something either way, but then they make up their minds, perceptions harden, and then it's really hard to change hearts and minds.
I think with government, there was a false assumption that because COVID has had such a devastating effect on people's lives, that vaccines were just going to be accepted wholesale, that people were going to have a good response to the idea that there was now some kind of intervention, medical intervention, that could supersede in the long term the non-pharmaceutical interventions and the things that come with lockdowns. However, that needed to come along with clear messaging that answers some of the questions that, the misinformation from the internet and from different sources from abroad and locally has been generating. And I think government has not always very clearly and directly addressed those issues and the kind of misinformation that's coming up. And so you hear the Deputy Health Minister giving kind of sporadic and almost off-the-cuff responses to what people think are really, really serious concerns. But there hasn't been a sustained effort from trusted sources, especially the scientists who have more answers and more clarity that can help people get past their hesitancy towards vaccination.
Yeah. So you needed more health experts, you're saying, talking about things like one of the big concerns is side effects. So is that how you deal with the misinformation?
Certainly. And if you think about what happened with COVID-19 itself last year, we got very used to having our scientists on the screen with us, trying to help us understand COVID-19, trying to understand how the waves work, how the spread of COVID-19 is happening, and how the lockdown is helping. We have not seen similar things coming from government, coming from different sources, where you have the scientists available to the public and giving that kind of information. So that voice of authority that the scientists had at the beginning of the pandemic has become softer and even missing in many ways when it comes to the vaccine. Yeah. And yes, it's questions about how the vaccine was made. It's questions about what vaccines actually do. There's a lot of confusion about what vaccines do. People are saying, I'm not sick, why do I need a vaccine? Things like that. And then there's, of course, just a level of trust that people are saying, well, we don't know what some of the politics and the economics around these vaccines are. Why is it coming to us for free? There's so many questions that need answers, and we need to encourage debate, and we need to encourage those questions coming up and being addressed so that we can start to counter misinformation, because not saying anything is not going to help us at this point.
Well, finally, is this a bit of a quandary for government? Because on the other hand, if it pushes too hard, people can become suspicious. And I've heard people talking about the fact that they're free, that people in the United States are bribed or often offered gifts to get the vaccine. And what's the agenda there? I guess what you're saying is if you push the health professionals to the fore and the politicians to the back, maybe there will be more trust.
Yes, certainly something that we at COVID Comms have been pushing in the vaccine messaging that we're putting out is speak to your local health providers. Speak to the people at your local clinic. Speak to your local GP. Because when you're getting information that you don't know the source of, and a lot of the information we're getting on Twitter or Facebook or WhatsApp, we don't always know the source of that information, and people are trusting those sources. But the source that you can engage with more trust are local healthcare providers. One, because the majority of healthcare providers in this country have already had their COVID-19 vaccine, and many of them have been kept up to date with answering all of those key questions. And so even just the basic general questions about people's own concerns about their own health status, it's very important when it comes to the vaccine that if people have underlying conditions or they have any health concerns, that they talk to a healthcare provider about what the implications of their health status might be for the COVID vaccine or any health-related concerns they have about side effects. The healthcare provider and the healthcare system is best placed to give that trust more than any politician, I believe, would be able to.
All right, thank you very much for your time tonight. Tessa Dooms from COVID Comms.